launch of the NDTV-Dettol Banega Swasth India campaign. We have been talking about the link between hygiene and health, but we really can't have this conversation without bringing sanitation into it. Lack of sanitation is a contributor to the global disease burden. Adequate sanitation together with good hygiene and safe water are fundamental to good health and to social and economic development. In fact, Mahatma Gandhi said in 1923, the sanitation is more important than independence. So before we start our discussion, I want to come to you first, Dr. Rodrigo. The recent study by Nature has found that the Swachh Bharat mission has contributed significantly to reducing infant and under 5 mortality rates across the country, averting 60,000 to 70,000 infant lives annually. Huge number. What steps can be taken to sustain and enhance this progress? And also, what do you think about the WHO findings on global health highlight and the critical link between sanitation and public health outcomes?
The connection between sanitation and public health outcomes is pretty direct and very, very important. Think about it. Poor sanitation, things like inadequate waste disposal, lack of hygiene, or open defecation creates the perfect environment for diseases to spread. And WHO estimated that globally, at least 1.4 million deaths and 74 million DALIs from diarrhea, acute respiratory infections, worm infections, all of which are attributable to unsafe water and sanitation hygiene. This is data from 2019. Swachh Bharat mission is the world's biggest sanitation campaign to stop open defecation, achieve universal access to safe sanitation. When in India, it's always the biggest campaign. That's the amazing thing with India. Now, I think for SBM 2.0, it's designed to sustain the gains of SBM 1.0. It expands the scope to open defecation-free gains by including solid and liquid waste management in both rural and urban areas. So it's like a whole ecosystem for environment-friendly and healthy spaces, whether urban or rural, for people. Globally, the biggest challenges in addressing sanitation are poor leadership and political commitment. In India, this is not an issue. India just needs to keep the momentum for more years to come. So sanitation is not a side issue. It is foundational to public health. By improving it, we directly improve health outcomes, lower disease rates, and boost the quality of life for entire communities and the whole country.
About dignity, not just about health. We have Ravi with us. Ravi, last night we were talking at length about this entire campaign. And tell us about the evolution of Banega Swasth India and its journey, how it scaled up over the years.
First of all, thank you NDTV for being a wonderful partner with us for over 10 years now. We're in the 11th season. I recall the initial days when we started with the Swachh bus, which visited few villages in India. We hardly had the concept of volunteerism at that point of time. Very fairly saying, we have 200,000 plus volunteers with us. This is on the top of the 100 partners whom we work with day in and day out. The whole force behind it is basically the state governments, the national government, and the kind of support what we get from our civil society partners. As Gaurav was there on the first panel, he talked about Plan India, Mamta, he talked about Jagran, he talked about many others. We initially were focusing on some parts of India which were termed at that point of time Bimaru states. So largely in Bihar, Madhya Pradesh, Orissa, and a mix of all that. And then the whole concept, there was a discussion where our G20 own Sherpa, Amitabh Kanji, talked about the aspirational districts in India. And we need to move our needle from, working in from the Bimaru to more concentratedly, more focused areas. We went to the aspirational districts. And last year, our global CEO promised we will be tripling our impact. From the aspirational districts, now we have reached to the aspirational blocks. The 5 key elements under the aspirational blocks, under those 5 elements, 2 things we are very, very sincerely working on and which are of our top priority. One is making, in the whole education vertical in the aspirational blocks, focusing on education, and that to the hygiene education. Second is how we focus more and strengthen the vertical on the primary healthcare. By the end of next year, we will reach around all the 500 aspirational blocks across India. Some of the early successes also I want to talk, Ayushman, in this. One of the very early successes was our work in Maharashtra, in Nandurbar and in Amravati districts, where the maximum number of children were dying because of the malnutrition, by stunting, and by other opportunistic infections. We took the challenge, we reached there, and a lot of people asked us, like, are you going to stay? Is your intervention is going to stay, and for how long? The intervention has stayed there, intervention has showed the result, and is a part of the NITI Aayog's best practices for the last year. Out of 10 best practices, 2 best practices come from our interventions, from our projects. And then now 2 other states requested us to do the same work. One state is Gujarat, which is Prime Minister's own state, and the second state is Rajasthan. So from Maharashtra, we have taken the intervention to Rajasthan as well as Gujarat. Looking into the success now, there are other states which are also opening up for the intervention. And we also took some baby steps with the school bus. We reached to 2,500 schools. There was a big time when, when I was asked, like, what is this 7,500 schools? India is a big country. It's a big challenge. Can we not scale up? Absolutely. Can we not do it more diligently? And yes, we took up the challenge under the guidance of our leadership and the support from the government and the civil society. And this year, I'm very proudly telling you, we have touched 1 million schools across India.
Wow.
And amazing. We are able to create 35 billion plus hand washing occasions with these school kids.
So, well, 1 million schools, that's a huge number. Honorable Prime Minister is addressing the nation. Can we just go across to him live to hear what he's saying, because it's extremely important day to day.
मेरे आज की 10 साल की इस यात्रा के पड़ाव पर मैं हर देशवासी, हमारे सफाई मित्र, हमारे धर्मगुरु, हमारे खिलाड़ी, हमारे सेलिब्रिटीज, एनजीओज, मीडिया के साथी, सभी की सराहना करता हूं, भूरी भूरी प्रशंसा करता हूं। निरंतर प्रयास करके ही हम अपने भारत को स्वच्छ बना सकते हैं। मैं सभी का, प्रत्येक भारतीय का हार्दिक आभार व्यक्त करता हूं।
And today we are thrilled to have with us, in studio with us, the talented and versatile actor Shreya Pilgaonkar. We're talking about sanitation and toilets. Shreya, thank you for joining us today. This very critical conversation as we launch season 11. Have you ever faced any personal challenges when you're shooting in the interiors, in remote areas, because there's not a toilet there? Tell us about that, because I think people would want to know, because this still happens.
Absolutely. Firstly, a big thank you to NDTV, and I've been sitting here and listening, and I think listening to all of you has been extremely informative. Hi, Ayushman.
Hi, Shreya.
I would say that these conversations are so important, because conversations around sanitation and hygiene are not just for the privileged. I think it's so important that at the grassroots level, at that micro level, we see a practical application and awareness of this. I will say, as an actor, I'll admit that several times these are questions that we ask, that when we're shooting in remote areas, will there be toilets? And I see the women asking these questions much more than men. But I do feel in the past few years, especially in villages or remote areas, I do see that change. I do see women asking, actively asking for equal access, especially for toilets. Because at the end of the day, sanitation and hygiene is really, that defines the foundation of the quality of your life. And I will take this opportunity to also talk about the dignity and value of our sanitation workers, because I feel like they are the ones who are literally going down there to ensure that life is clean for us, so to say. So I feel like, as citizens and for the dignity of labor in this country, it's very important to make sure that they get that respect and good facilities to ensure their safety as well.
एब्सोल्युटली आई थिंक डॉक्टर अश्विनी, अगर मैं आपसे सवाल पूछूं यहाँ पे, जैसे श्रेया जी ने कहा, हम बात कर रहे हैं कि टॉयलेट्स कितनी ज़रूरी हैं, इम्पैक्ट की अगर हम बात करें, आपने तालुका में क्या देखा है जब से स्वच्छ भारत मिशन आया है, ये कैंपेन बनेगा स्वस्थ इंडिया काम कर रहा है जो हमारा कैंपेन, 10 सालों में आपके तालुका में हेल्थ को लेके कितना इम्पैक्ट आया है और इकोनॉमिक इम्पैक्ट ये, क्योंकि ये भी कहा जाता है, यूनिसेफ ने एक स्टडी की है कि करीब 50,000 रुपये एनुअली बचते हैं अगर पूरे परिवार की सेहत ठीक रहे, तो इट्स अ बिग इकोनॉमिक इम्पैक्ट.
Definitely. Actually, I have been working in the taluka you have just mentioned. I have been working since 1 year, but I have started my journey with this since like 6 to 7 years back when I visited Chhattisgarh state. In that there is Jashpur taluka district. So वहाँ पे हमने 300 गाँव में हमारी मेडिकल टीम गई थी. वहाँ हमने देखा, वहाँ में एक्चुअली ट्राइबल एरिया, मतलब उनके घरों में जाके उनके पास में खाने का कुछ ये नहीं है वगैरह, ऐसे मतलब पॉवर्टी, पूरा जो आदिवासी एरिया है वहाँ पे मैंने देखा है. दे जस्ट डोंट नो कि हैंड वॉशिंग भी कुछ रहता है, मतलब दे डोंट नो दैट आफ्टर डेफिकेशन यू हैव टू हैंड वॉश ऑल्सो. सो दैट वाज द कंडीशन आई हैव सीन. और जब मैंने यहाँ पे हमारे मालेगांव तालुका में भी देखा, so the period like 7 to 8 years when this campaign of Swachh Bharat Mission, then also the NGO like Plan India are working since then. I think the impact I have seen is कि अब अगर हम जाते हैं वहाँ पे तो वो उनको जो स्टेप्स है, एक्चुअली हैंड वॉशिंग की जो स्टेप्स है वो हम भी शायद फॉलो नहीं करेंगे उतने टाइम में, तो वो आपको सब करके दिखाएंगे. द बिहेवियरल चेंज एक्चुअली हैज़ हैपेंड.
We are now heading into a very short break.
अब हमारे साथ नितिन गडकरी जी जुड़ रहे हैं और नितिन जी ने हमारा साथ बहुत सारे सीजन्स में दिया है. नितिन जी, आपका स्वागत है हमारे मंच पर. पहला सवाल आपसे कि आपके मंत्रालय ने बहुत काम किया है और जिस जन भागीदारी की बात प्रधानमंत्री अभी कर रहे थे, उसमें जब कोई भी लोग अपनी ज़मीन देता है तो ये भी बोलता है कि इस पर टॉयलेट बनाया जाए और उसी रास्ते से आपकी सड़कें जाती हैं. तो जब आपका मंत्रालय ने काम शुरू किया तो क्या क्या सपोर्ट आपको मिला और किस तरह से ये मास मूवमेंट बना?
देखिए, सबसे पहली बात तो ये बहुत महत्वपूर्ण है कि हमारी सस्टेनेबल जीवन पद्धति के लिए स्वच्छता हमारा एक प्रकार से जीवन है और इसलिए हमने एक थ्योरी पर काम किया है कि कन्वर्शन ऑफ वेस्ट इनटू वेल्थ, और इसलिए वेस्ट में वैल्यू क्रिएट करो. सबसे पहला अच्छा काम ये हुआ है कि हमने दिल्ली मुंबई हाईवे में और UR2 में और डोलारो अहमदाबाद हाईवे में, चंडीगढ़ में और देश के अनेक जगह पर 80 लाख टन से ज़्यादा कचरा रोड कंस्ट्रक्शन में डाल दिया है. और अभी हमने जो कचरे को सेग्रीगेट करते हैं उसके लिए कॉन्ट्रैक्टर को ये जो मशीन लेनी पड़ती है सेग्रीगेशन की, इसके लिए भी हम उनको अब मदद कर रहे हैं. सबसे अच्छी बात है कि हमारे ट्राइबल क्षेत्र में बाम्बू होता है और अभी हम लोहा यूज़ करते हैं जिसके कारण कार्बन डाइऑक्साइड बाकी सब बातें होती है. तो अभी हमने 80 किलोमीटर बाम्बू के क्रैश बैरियर हमने तैयार किया और उसका यूज़ किया हुआ है. इसके साथ साथ फ्लैश हमारे लिए एक बहुत बड़ी समस्या थी. बड़े प्रमाण पर अब फ्लैश रोड में हम यूज़ कर रहे हैं जिसके कारण फ्लैश का शॉर्टेज हो रहा है. स्टील फाइबर जो वेस्ट होता है वो स्टील फाइबर का भी हम यूज़ कंस्ट्रक्शन में कर रहे हैं. और सबसे अच्छी बात है जो ग्लास है, ग्लास फाइबर स्टील, ये हमने नया लाया है. अब इसका भी उपयोग करने वाले हैं जिसके कारण कॉस्टिंग भी कम होगा और रस्टिंग का प्रॉब्लम नहीं आएगा. सॉइल स्टेबलाइज करके जो अर्थवर्क करके मिट्टी लेनी पड़ती है उसमें 80% मिट्टी बच सकती है. वो उसको सॉइल स्टेबलाइज करने के लिए हम स्टेबलाइजर भी यूज़ कर रहे हैं. बाद में जो बिटुमिन है उसमें अभी मैंने मीटिंग बुलाई अगले सप्ताह में. वैसे ऑलरेडी प्लास्टिक को, रबर को हमने अलाउ किया है. हमारे देश में 90 लाख टन बिटुमिन आता है, उसमें से 40 से 50 लाख टन हमारी रिफाइनरी की कैपेसिटी है और 40 से 50 टन इंपोर्ट होता है। अभी हमने मैं इंडिया की जो ऑयल कंपनी है उनको रिक्वेस्ट करने वालों, रिफाइनरी वालों को, कि भाई आप 15% रबर और 7% प्लास्टिक डालकर वो बिटुमेन हमको बना दो, ताकि हम उसको डायरेक्ट सर्टिफाई करेंगे, यूज़ करेंगे, जिसके कारण वेस्ट प्लास्टिक और वेस्ट रबर का यूज़ होगा और हमारी कॉस्ट भी कम होगी। ये वेस्ट रबर और वेस्ट प्लास्टिक 25 रुपये 30 रुपये किलो तक आ जाएगा और जिसके कारण बिटुमेन की कॉस्ट भी 10-15 रुपये हमको इंपोर्ट करने की भी ज़रूरत नहीं पड़ेगी और रोड की क्वालिटी भी सुधर जाएगी। इसके बाद हमने विशेष रूप से ये हमारे रोड कंस्ट्रक्शन में हमने जो अलग अलग प्रकार की टेक्नोलॉजी लाई है, उसमें प्री कास्ट को अभी हम मैंडेटरी करने वाले हैं। प्री कास्ट को मैंडेटरी करने से जो रोड पर स्टील सीमेंट आता है उसके कारण जो पोल्यूशन होता है वो नहीं होगा। फिर फाइबर रीइंफोर्स पॉलीमर FRP को उसको भी हम इनकरेज कर रहे हैं। इसके साथ साथ मुझे बहुत खुशी है कि हम ये जो हमारी परली है इससे इथेनॉल बना रहे हैं, एविएशन फ्यूल बना रहे हैं, उसमें अभी बायो बिटुमेन भी तैयार हो रहा है जो हमारे देश में प्रदूषण करता है वो भी कम हो जाएगा और किसान, गांव गरीब मजदूर किसान समृद्ध होंगे और देश का पर्यावरण और स्वच्छता अभियान बहुत अच्छे तरीके से यशस्वी होगा।
Thank you, Gadkari ji, for being a part of the launch show for this 11th time. Thank you so much.
Well, now we also have joining us is Mr. Amitabh Kant. He's the G20 Sherpa, also former CEO of Niti Aayog. Thank you so much, Mr. Kant, for joining us today.
Mr. Kant, my question to you is, this is Ayushman, my question to you is, how can we encourage more collaboration between Indian innovators, global health organizations, and government bodies to develop and implement effective health solutions?
So that's a very critical question because a lot of innovation has been done, like the twin toilet in India. We've seen huge innovation in places like Tamil Nadu, in Kerala, where community has become a part of this movement. I mean, beaches in Kovalam, for instance, were cleaned up by the community. And similarly, much of the movement in Indore became community-centric. That is, people did not allow others to litter. I think what we have to do in the next course is work with international community. There are a lot of global best practices in different parts of the world. We have to adapt them to India. And I think there are many United Nations organizations who are willing to collaborate with us. The Bill and Melinda Gates Foundation has collaborated with us to do a lot of innovation in many of these areas of both sanitation, garbage collection, municipal waste. The challenge is really to ensure that our waste gets converted into wealth. And that wealth has a huge economic dimension. It can be the biggest job creator for us. And while we are creating waste, it will also have a multiplier impact on the air quality in many of our cities. So all these are very critical issues, and this linkage between community, the people, innovation, and global organizations has a very huge multiplier impact. And I think many of our civil society organizations are working towards this.
Thank you so much, Mr. Kant, for joining us today. What's coming up? A high voltage performance to get you all off your seat.
लंबड़दार MC Square सिद्धे हरियाणा तक सुनेगा सुना दूं बदमाश छोरा तेरी छाती में काटा सुधी फौज छोरा सब लैंडर पे काटा पूरी मौत छोरा NCR में रखा पूरी धौस छोरा मैं बदमाश छोरा तेरी छाती में काटा सुधी फौज छोरा सब लैंडर पे काटा पूरी मौत छोरा NCR में रखा पूरी धौस छोरा माशूका की मर्जी चले आशिक के कुछ हाथ नहीं मैं ते पागल होया फिरूं तू करती कदे बात नहीं मैं ते पागल होया फिरूं तू करती कदे बात नहीं छोरी मैं ते पागल होया फिरूं तू करती कदे बात नहीं घड़ी तेरी घूर है तेरी घड़ी सहेली कुछ तो दुबकारी है तू बोले तेरी निगाह दर्दू मैं खोल करे जो सुन ले तू बोल करे जो हाजर भी दे दी जो फिर हाँ करियो चेना मैं हूँ सूटो सा छोरा करूँ कौन का बिल्लो शहर की छोरी